Wilson. Mr. Courtney, you're recognized for 5 minutes.
Thank you, Madam Chairwoman and Acting Secretary. It's great to see you here today, and thank you for your amazing service. Again, just to chime in a little bit on your last colloquy, in the state of Connecticut, we have roughly about 90,000 job openings. Our labor participation rate is above the national average. It's about 64% higher than during the Trump administration or during COVID for sure. And the way, we clearly had realized that we have to sort of, fill those positions is to close the skills gap. The Labor Department's Workforce Investment and Opportunity Act is hard at work right now. They graduated 935 metal trades folks last year down at our submarine shipyard that, again, that would not have happened if it wasn't for WIOA. We are also have WIOA programs in the healthcare sector. I was just with a group called CNA Boot Camp, where again, it's a WIOA-funded 8-week intense program to get people trained and certified to fill all of the gaps that we have in nursing homes and hospitals. Immigrant population is probably the largest cohort that's benefiting from that program, Haitian community that we have in Eastern Connecticut. And again, it's a really highly efficient, good return on investment in terms of job training dollars in an accelerated fashion to help deal with, again, what is still a lot of job openings in the economy. But that wasn't why I wanted to ask you about today, as I think you know. You came up and visited my district about 4 months or so ago and visited with the nursing community in the state there. Again, at the time, as you recall well, I'm sure, we lost a valuable, compassionate nurse who was a victim of workplace violence. She was stabbed to death on a home health visit with a very high-risk patient. Never should have happened. Again, OSHA has done an investigation. There is a penalty, but it's an after-the-fact and relatively meager amount in terms of the value of a human life that was there. I know the department's working on workplace violence prevention OSHA rule. Can you give us an update? And obviously it's something that I think the entire healthcare profession is desperately looking for.
Yes, thank you, Congressman. And it was a pleasure to be in your district with you when we went to Three Rivers Community College and talked to people who both knew about that tragedy and who talked about the challenges in the profession. So we are working on a rule on workplace violence. We want to make sure that we go through every step, as we always do in our rulemaking. We have completed the small business review part of that process and are working on the proposed rule, which will be coming out soon. Also, you mentioned the importance of OSHA and safety investigations. Obviously, we investigate cases after there are injuries or deaths, but to your point, the more we have a system in which employers are motivated to prevent those things from happening before they happen, that's obviously the ideal situation, and penalties that aren't seen as a cost of doing business are very important for that.
Thank you. And again, the folks that heard from you, were totally convinced at your sincerity and commitment to doing this. One way Congress could help is for us to pass the Workplace Violence Prevention for Healthcare, H.R. 2663, which has 165 bipartisan co-sponsors. It passed in the last Congress with over 240 votes in the House. And really one of the key things that it would do is it would accelerate this rule process so that we could get these protections in place quicker. That's exactly what Congress did during the AIDS crisis to get emergency rules through so that today people wearing gloves, disposable needles, all that flowed from the fact that Congress acted to accelerate those rules. Lastly, we have a bill in committee, the Federal Employees Worker Compensation Act, which would empower nurse practitioners and physician assistants under the federal workers' compensation system to be able to evaluate patients and issue reports that could be connected to benefits. Can you talk about the department's position on that measure?
Yes, thank you, Congressman. So one of the things that we have seen is that a lack of adequate medical professionals to evaluate those federal workers' compensation claims is a problem. We have tried to address it. We've increased the number by about 20%, but it remains a challenge. So I very much am anxious to welcome the opportunity to work with you on that proposal.
Great, thank you. I yield back.
Thank you, Mr. Courtney.